Have you noticed a change in your vision that isn't being corrected with contacts or glasses? It could be a condition known as keratoconus. The good news is that it's a condition that can be corrected with a relatively simple procedure that's being done right here in KELOLAND. We recently sat down with Dr. Vance Thompson at Vance Thompson Vision to learn more about one of the new treatment options. Thanks so much for joining us today, Dr. Vance Thompson.
Thank you for having me.
So start off by explaining to us, what is keratoconus?
Well, the cornea is the front window of our eye, and a lot of people don't realize it provides 80% of the focus power of our eye just because of the curvature. Well, if that curvature becomes irregular, vision becomes irregular, and with keratoconus, it's a long word, but kerato means cornea, and conus means cone-like. And it's where our cornea starts to bulge and become irregular, and then it focuses light irregular and causes blur.
So what are some symptoms of this?
Well, early on, it may be that you're just having a change in nearsightedness or an increasing in astigmatism, and that's why it's good to have a good eye exam. But some of the other symptoms besides your refraction or astigmatism changing is you get some blurring, and you might not see as crisp with your glasses or contact lenses. And in the end stage, it can be very blurring if not properly cared for.
So what causes keratoconus? Is this just genetics, or are there things that can actually cause it?
You know, there's a loose genetic association. About 1 out of 10 keratoconus patients have another family member with it, but the majority, they're the only one in their family that has it. And it can be associated with eye rubbing. You see people with untreated allergies that really itch their eyes and rub on them a lot, that it's almost like a tire, that if you rub the tire, it starts to bulge and wear out. And if you rub the eye, it starts to bulge and wear out. And that's one of the reasons we ask every single patient if they're an eye rubber, and we suggest to eye rubbers to get your allergies treated, even if you're a kid.
So tell me about the new technology, corneal crosslinking, and how that goes with keratoconus.
Right. Well, with crosslinking, what it's doing is working on the collagen. Collagen is all over our body, in our skin and our hair, and also in our corneas. And our cornea is almost like 160 sheets of paper. It's 160 sheets of collagen.
Wow.
In a very highly organized way. These collagen fibers are parallel in that sheet, and they're connected by little cross links. And those cross links are what provide strength. The combination of vitamin B2 or riboflavin and ultraviolet light from the sun make our skin get stiffer. It makes our corneas get stiffer. And so that's natural cross-linking, and when we're treating someone, we can use that to our advantage and actually accelerate it to make someone's cornea be more healthy.
And for developing this new technology, Vance Thompson Vision played a role in this. So tell me about that.
There's a great history behind corneal collagen cross-linking. And we were asked to be a part of the United States clinical trial here. I actually had the honor of being one of the medical monitors, which kind of oversees the United States trial. And my partner, Dr. Birdall, and I were both investigators in the trial, where we treated for many years a lot of patients to help show the FDA that this was a safe and efficacious, meaning that it strengthens the cornea, treatment. And so it was really exciting to be involved in the FDA approval of it.
And what kinds of patients would benefit from the corneal cross-linking?
Well, what's amazing is this happens to people that are 10 years old, 12 years old, 14, 20, 25. And that's when our skin is more supple. It's when our corneas are more supple. And so if they have a changing astigmatism or nearsightedness, this is something that's worth making sure isn't the cause. And then you can go ahead and be cross-linked at a young age and actually have a very normal cornea for the rest of your life. What's difficult is when it's ignored. Then we drift into some of the other treatments, like some of the surgeries we do, but hopefully cross-linking is going to halt the progression so that they have a normal cornea for the rest of their life.
So what are some of those other treatments that can be used for keratoconus?
Ideally, we don't need to get to the end game, which is a new cornea. That's a corneal transplant that is donated, and then we, take off the diseased cornea and sew in the donated cornea. We want to try to prevent that, and there's really two things that after glasses and contact lenses aren't working anymore and they didn't come in for cross-linking, so they have a quite irregular cornea, there's a procedure called intacs. And with intacs, they're like two little segments that almost take the dome-like cornea and flatten it. And almost like the stakes in a tent can help bring stability to that tent. That's what intacs can do. But the goal is to catch this early and cross-link the patient so they don't have to get to the corneal transplant.
Okay, so these other treatments that you're mentioning, these procedures, can those be done in conjunction with corneal cross-linking?
If we feel like it's an advanced case and cross-linking will help and intacs will help, we can actually combine them, and we do that a lot.
Okay. And how about this procedure? Can it be followed by a refractive procedure like LASIK?
Right. Well, it actually can. Usually we're not doing LASIK on keratoconus patients, but we are doing PRK, and it can be very, very effective in helping them.
Is this covered by your insurance?
70% of the people we see for cross-linking, their insurance helps them out, and that's been very helpful.
All right, well, thank you so much, Dr. Vance Thompson, for joining us today and telling us all about it.
Thank you so much for having me.
If you're wondering whether you could be experiencing the early signs of keratoconus or think you know someone that might be a good candidate for corneal cross-linking, call Vance Thompson Vision in Sioux Falls at 605-361-3937 or visit their website at vancethompsonvision.com.